Okay, I am logged into Genesis along with the Service Journey app. So this is the Genesis desktop. In this desktop, I can log in and check my schedules. I can place and receive phone calls. I can receive chats. I can receive emails in here. In the center here, you see the Service Journey crisis case management system. And as you can see, it's tightly integrated inside of Genesis. So it's all part of one user desktop with seamless login. A couple things about this. As a caseworker, you can see I have some cases actually assigned to me, and I also have some tasks. So in our system, we can have the continuation of care cases, and those cases can generate different tasks that are either automatic or, in this case, I set myself a follow-up task to call and follow up with MCT on a certain case to see what happened. So this concept becomes available to me again as an agent. And for example, I can open up any of these and continue on with my case management work. There is also a concept of automatic distribution of these cases. So if you have different case workers, we can push cases through a workflow into what's called an inbox concept. So as cases are assigned to counselors or caseworkers, they will receive them in their inbox. They can receive notifications, of course, and they can pick them up and go ahead and work on them. Within the case model, you'll be able to see everything that happened on the intake side. So, for example, here we have a caller. Caller's name was Todd, and the main primary presenting issue was suicidal thoughts and related to some domestic violence. So, based on the intake, what the intake agent typed in or the counselor typed in, and based on auto summarization capabilities of our system, we've summarized the case and all the information that we know about the caller. And we can also see different things that happen chronologically with this person as well. Again, going back to different referrals that were set up. Here we attempted a follow-up with that person via outbound call. Of course, all done inside Genesis. We can see the outcome of that call. There was no answer. On the second attempt, 2 days later, we did contact the caller. So different things happen in the journey, the continuation of care. For example, here, the risk increased as part of that journey, and we considered dispatching the MCT. And in this case, we actually did. So all this information is tracked both automatically and as the counselors and caseworkers make notes and make referrals. We can also see directly the different referral partners that were involved, different treatment centers, or in this case, substance abuse or mental health treatment. And, these are all part of the case management and omni-channel journey. So we can dig in and look at details, why they were recommended. As I mentioned, there's also a task model. So you can see all the tasks that have been generated for this case, follow-ups and things of that nature. We also can have an internal discussion board for collaboration amongst different people in 988 or as part of the system. And we do have a comprehensive document management system. So all documentation that's related to this case, these could be forms, they can be medical releases, different things that were sent or received related to this case. Here we have some type of drug information, so all that can be covered here. It's also important to realize that all communications that go on in relation to this case, which could be, of course, with the client, but also with other providers, can include not just the phone calls, but emails and SMS. So any inbound, outbound emails would be captured in the same system and routed to agents in the same system via Genesis, of course. So very comprehensive there in that case, as far as the continuation of care. Now, back to my role as an intake counselor or an intake agent, I am logged in, of course, in Genesis, and I can go on cue and get ready to receive phone calls or emails or whatever comes into the 988 center for me to handle. Okay, so we're going to walk through a short phone call with an actual caller, just to show you the potential agent or counselor experience during an intake call. Thank you for calling 988 Suicide Crisis Lifeline. My name is Todd. I am here to listen. What's going on for you today?
I don't really know how to start. I almost hung up.
Really glad you didn't. And you can take your time. There's no rush. What would you like me to call you today?
I don't want to tell you.
Okay, no problem. You can be anonymous. So what's been weighing on you most today?
I just, I don't think I can do this anymore. Everything feels pointless. I just feel like I'm done, like people would be better off without me.
So, really sorry to hear you're feeling that way. When those thoughts come up about people being better off without you, have you been thinking about hurting yourself?
Yeah, I have.
Okay. All right. Thanks for telling me that. I know that takes courage. Um, and have you actually thought about how you might do it?
I I thought about taking a bunch of pills. I have them here at home.
Hmm. Okay. Well, look, I'm here. I'm here with you, and we have a number of professionals that can help you through this tough time. Um, they're really good listeners, and while we talk, I'd like to include these professionals on this call. Is that okay with you?
That's okay.
Okay, so just stopping here for a moment, I can, utilizing Genesis capabilities, I can bring in a consultation with a counselor or MCT personnel, or I can transfer the phone call. For our purposes, I'm going to continue on with the call, but all of the standard Genesis capability for call transfers, call consults, conference calling would be available at this point to help this caller. So, but for now, I'm going to go ahead and continue on. So, hopefully that call was helpful for you. I'd also like to send you some information about some of the concerns you told me today. Is it okay if I email those to you?
That'd be great.
Okay. Can you give me your email?
Um, yeah, you can email me at john@example.com.
Okay. Okay. John@example.com. And so I'm going to go ahead and send you some referral information and for, a little bit of mental health follow up. Okay. And you should receive this in your email right away. I'm also going to dispatch over to help you with our mobile crisis team, and I hope that's okay.
I guess so.
Okay. Can you maybe tell me exactly where you are? Do you have an address where you're located right now?
123 Main Street.
Okay. All right. That's great. Well, thank you for that. So I'm going to go ahead and dispatch what we call our mobile crisis team. Okay. And I'm going to schedule a follow up to follow up and see how you're doing. And like I said, you should have received that referral information that I sent over there today. Okay. So you be well and take care of yourself. And based on what I see, the mobile crisis team is going to be on their way to you at 123 Main Street. Okay.
Okay.
Okay. Thank you very much. Okay, now a couple things to note in continuation of the demonstration. This is an application that we have as an example to illustrate the mobile crisis team app receive the dispatch automatically. Now, in this case, they can go ahead and accept the dispatch. They can provide an ETA to how far away they are. And very importantly, you can also see that they received an automatic summarization based on the call transcript and everything that went on to help them know what's going on as they're headed over to help this person. They also, tied it into the referral we made to the health counseling service. So this app is real time with the 988 system. So as they mark themselves accepted with a 10-minute ETA en route, even though the caller is hung up, you can see that our system is automatically updated with that information. Now, a couple other things that I'm going to note. Again, the caller is, assumed to hung up at this point. I am going to just terminate, but I want to show you that in the background, the system has went ahead and created the continuation of care case. And in this example, a couple things that are really important that I can do as the counselor. I can augment the case that was created for the follow-up counselor. I can also validate everything that was collected via the transcript. So that's really why they're very important that we have the ongoing transcript so I can check the accuracy of everything we've collected. Of course, we do have the voice recording that's been recorded as well with Genesis. It's also, if the caller mentions suicide or other specific words, the system would also make automatic suggestions, like knowledge-based suggestions as well. And then lastly, the system automatically created a summary of the whole call. And that takes all the information from the case, from the phone call, the notes of the counselor, and creates a full summarization of everything, including the plan of care and the plan of action as it stands right now as well. A couple other things to note here that are also important is that because of the live voice transcription capabilities, our system can assist the counselor or the intake agent with automatic data entry as they go through the intake process. So this is what we call it. It's not an autonomous agent. It's an assistant agent that can help with the intake person be able to spend less time doing data entry and more time actually talking, de-escalating, and providing good service to the caller. So that's a capability that can be added later on. So it does use our summarization and AI assistant agent, but again, it's not autonomous. It's actually an assistant to the specific agent. Okay, now just very briefly, as we've mentioned earlier, this is configured on a no-code platform that allows us and or you together to define things like your business process. So when we talk about the continuation of care and the case management, everything that goes into that, including the whole intake process, are all configurable items as to how your workflow works. So here where there's a simple case management workflow, all the business rules, the escalations, and the SLAs. This also extends down to the pages that the intake agency sees, all those forms. So this is what we call our no-code page designer. So you can see here some of those tabs I showed you. So you can drag them around, you can rename them, you can add the fields and the forms you want, different custom buttons even. So one of the use cases, for example, when we do a 911 dispatch, we might integrate directly with your county's RMS or CAD system. So with those integrations that we already have out of the box for a lot of the standard providers of that service, like Entrado, we can add in those custom dispatch buttons here and functions and add those into the intake and or case management process. So everything is very configurable and changeable to adapt to your way of doing things, your business rules, your titles and field names, and your business process and integrations. So entirely no code, low code, and changeable. Thank you very much for watching.